Hi, my name is Danielle Stylen, and I'm the PA at Caring Medical, and I wanted to take a few minutes to talk to you about shoulder arthritis and why it's better to treat it sooner rather than later. So at Caring Medical, we often see patients that have either been diagnosed with shoulder arthritis in the past, or told they needed a replacement, or just come in with initial shoulder pain. So often what we see is someone may have sprained their shoulder, meaning that they've injured some of the ligaments that help to keep their shoulder stable. Now, ligaments are really dense, fibrous tissue that help hold all our bones together. So you actually do have several that surround your shoulder joint to help keep it in place. When we fall onto our outstretched hand or get hurt somehow on our shoulder, we can sprain those ligaments. Now what happens is when we have those loose, now injured ligaments, and our bones actually are able to shift a little bit more than they should. Because like I said, ligaments hold bone to bone, so when they can't do that job, your shoulder in this kind of ball and socket model can move around a little bit more. Now, it's painful, so we might take anti-inflammatories, rest our shoulder, maybe put some ice on it, and hope that the pain goes away. And it very well may go away, but the shoulder is still left a little bit unstable. The reason why is ligaments, if you look, they're white tissue. They don't have a great blood supply. They're not like muscle, where muscle's red, has a great blood supply, so they don't tend to heal really well. Plus, if we are further taking anti-inflammatories, putting ice on the joint, maybe even getting a cortisone shot, we really don't ever give them a chance to heal it at all, because that's going to shut down any blood flow that's going to that area. So when we have this initial injury and we don't do really anything to heal it, those bones are going to keep shifting more and more. Even if we mask the pain and we still go out and play tennis and play basketball or any other sport where we actually use that joint, we're just going to further the problem, because now we don't have pain, but we're still doing a lot of activity on that unstable joint. If we keep doing this through months and years and so forth, what eventually can happen is, as that bone continues to shift and move more than it should, is your body's going to react. Initially it's going to swell the area as a way to try to kind of keep some false stability there. If we keep shutting down that swelling with anti-inflammatory medications, cortisone shots, eventually it's going to think of other ways to help stabilize the area. Long term, it's actually going to start to overgrow bone. So you'll even see on x-ray that people have bone spurs, extra bony projections that are growing off the bones in their shoulder, because that's the only way their body knows how to react. If you keep playing tennis or keep playing basketball or badminton or whatever it is and masking the pain, that doesn't mean that there's nothing else going on. If you develop enough bone spurs, they can actually start to pinch on the rotator cuff, tendons, and muscles and ligaments and all the other tissue that surrounds the shoulder, which again is really painful. Even some people might say, hey, that's really painful, and they don't even use their shoulder. They kind of keep their elbow by the side. Long term, they might develop something called a frozen shoulder, where there's actually, they can't even move their shoulder more than this or more than this, and they can't brush their hair, brush their teeth, because they just haven't taken care of the initial problem. That's where prolotherapy comes in. So prolotherapy to that tissue is going to help strengthen those ligaments, get that stability back in the joint, and help you be pain-free and able to keep playing sports and being active and using your shoulder for everyday living. If you wait until you develop all these extra bone spurs, then it gets a little more problematic. It's more pain for you. If you can't move your shoulder, that makes it a little bit more difficult, and so forth. Some people, if they wait too long, actually do need to get their shoulder replaced because they've just got too much extra bone going on there. If you address it sooner rather than later with prolotherapy injections to all those structures, even if you have rotator cuff tendon tears, we can treat that just to help create more stability in your shoulder, keep it healthy, and prevent further problems down the line. If you have shoulder arthritis, or if anything that I said kind of sounds familiar to you, like you might have similar symptoms, you can contact us directly at info@caringmedical.com or visit our website www.caringmedical.com. Thanks for watching.